Hey guys, this is Dr. Yuvraj Jadeja. I'm a practicing obstetrician and gynecologist, an infertility and sexual wellness expert. And today I'm here to talk about a very important and a very popular topic, UTI, which means urinary tract infection. So what is a UTI? UTI is an infection of the urinary system, the system which contains of a kidney, the ureter, the bladder, and the urethra. UTI could infect any of these regions. When it infects the urethra, which is the last end of the tube, it is known as urethritis. When it infects the bladder, it is known as cystitis. And when the infection reaches the kidneys, it is known as pyelonephritis. Well, urinating is a part of our day-to-day life. All of us pee multiple times a day. Urine is a byproduct of a filtration system, especially the kidneys. When waste products and excess water in your body is removed by the kidneys, urine is created. Typically, urine does not have any harmful organisms or bacteria. It is clean. But sometimes, due to various reasons, it can get in from outside and cause infection and inflammation. This is what we call as UTI, urinary tract infection. In fact, UTIs are so common that around 15 million people around the world get a UTI, if not more, every year. Who are the people who are more prone to UTI? 1. People with vagina. People with vagina have short urethra, and the proximity of the urethral opening to the anus makes them more prone to UTIs. Second, older people. People who do not drink enough water, hold urine for too long, people with diabetes and kidney stones, and lastly, people with bad unhygienic practices and people who very frequently engage into unprotected intercourse are more prone to UTI. Now, how does one realize that they have a UTI? Meaning, what are the symptoms of UTI? First is your increased frequency of urination or urinary leaks. Second is pain and burning during urination. Third, you might also have associated abdominal pain, pelvic pain, pain in your flanks, etc. Also, if you have a cloudy, different color urine, bloody urine, you should think of a UTI. UTI sometimes, when severe, is also associated with fever, chills, malaise, fatigue, etc. And now, how do you diagnose that you have a UTI? First, of course, is the history, the symptoms that we've discussed before. Second are tests. In the test, first is a simple urine microscopic and routine test, which will see for pus cells in your urine, which is an indirect indication of a UTI. Second is a little bit advanced urinary test, which will see which is the exact organism that is affecting you and what antibiotics are going to work against it. This test is known as a urine culture sensitivity test. Mind you, both of it requires you to only give a urine sample. Now, what is the treatment? Treatment would involve 1. Good hydration on your part. 2. Antibiotics that are effective against your UTI. And 3rd, you might also require an alkalizer, which will help you flush off all the toxins and organisms from your urine. In this entire discussion, the most important point lies in points how to prevent UTI. Prevention is always better than cure. That's a cliche for a reason. So how do you prevent it? First is practicing good intimate hygiene practices. Second is keeping your bathroom and toilet areas clean as possible. Third is keeping yourself well hydrated. That means remember that you're drinking enough water throughout the day. Fourth, don't hold your urine for too long. And fifth is having good sexual practices, which means using water-based lubricants, using always a protection, and preventing and protecting yourself from STIs. Urinary tract infections are a very common entity. At the same time, it's easily treatable and manageable, but sometimes it can create a havoc in your body. So let's err on the cautious side. Take care of ourselves and body. So let's keep ourselves healthy and away from UTIs. Good day.